You can have a baby if you have polycystic ovary syndrome, and here's what you need to know to achieve it. Around 6% of reproductive age women in Mexico have PCOS, which is a hormonal imbalance where the ovaries produce excess male hormones or androgens, causing various issues. What symptoms may you experience if you have PCOS? Menstrual irregularities like oligomenorrhea, which is when your periods occur at very long intervals, or amenorrhea, which is the total absence of menstruation. Undesirable hair growth on the face, chest, abdomen, legs, or buttocks. Acne or skin discoloration. Weight gain or obesity. And muscular hypertrophy and breast atrophy, and infertility. How is PCOS diagnosed? To properly diagnose a woman with this condition, a specialist doctor needs to perform hormonal studies. They may also perform a transvaginal ultrasound to observe the number of follicles in the ovaries, which should be between 6 and 12 per ovary. Those with PCOS may have more than 40 follicles, which compromises their ovulation process and causes problems with having a baby. What treatment is available for polycystic ovary syndrome? Each woman and each case is different, so it's important to consult a specialist doctor who can determine the best treatment for you if you suspect you have PCOS. The following treatments are usually recommended for this condition: birth control pills, progesterone therapy, low-calorie diet, moderate physical activity. Can I get pregnant if I have PCOS? Infertility is one of the most common consequences associated with PCOS due to hormonal imbalances that do not allow for normal ovulation. About 30% of women with PCOS in Mexico may even experience a total absence of ovulation, also known as anovulation. However, assisted reproduction currently provides alternatives to help women with this syndrome fulfill their desire to become mothers. What are the alternatives for assisted reproduction to become a mother if you have polycystic ovary syndrome? If you have polycystic ovary syndrome, ovulation induction, which is a low-complexity assisted reproduction treatment, can help stimulate your egg production through the use of medications. This is especially recommended for women who are under 33 years old and whose fallopian tubes are permeable, and who has been trying to have a baby unsuccessfully for less than 3 years. If medications are not enough to conceive, your best option to have a baby if you have polycystic ovary syndrome is in vitro fertilization, IVF, which allows for the selection of the best quality eggs for subsequent fertilization and implantation in your uterus. If you want to have a baby and have polycystic ovary syndrome or suspect that you have it, remember to go directly to a specialist in reproductive biology. They will determine after the relevant studies which is the best treatment for you. Polycystic ovary syndrome is no longer an obstacle to living your motherhood. If you have more questions about polycystic ovary syndrome or any other topic related to your fertility, click on the link in the description and we will help you resolve them.